Russell, and I am interested in healthcare management, especially when it comes to practice management. I am a recent graduate of Bryan and Stratton College, and I graduated with my bachelor's degree in health administration services. I've always been passionate about healthcare and look forward to possibly working for this organization. My salary expectations are probably around 50,000 a year, and I chose this profession because I've always been passionate about healthcare, and my family has always been involved in healthcare. My mom was a director of operations for a kidney care company, and my sister's a nurse. And also, what's brought me to the healthcare profession is that my dad was diagnosed with Parkinson's disease when I was in high school, and just seeing his experience with receiving that diagnosis eventually after a long period of time was just eye-opening how impactful the healthcare profession is, even the administrative side, where that experience is just so important to have a positive experience for the patients. And some examples of my time management skills are probably when it comes to me being a caregiver. The past 4 years, I've had to take care of my dad for my mom and make sure to make his appointments and make sure that he gets his appointments on time, to take care of his medications, make sure they're in the pill box, make sure he's taking the pills at the times that he needs to. I also prepare his meals and make sure that he is eating a balanced diet and that he's remembering to eat at certain times of the day. And some important characteristics I bring are problem solving, which was probably more in when I was in a LuLaRoe consultant position, and I had to manage many different clients, and they would bring up issues, especially with the items, and I would have to resolve the issue. And also, I feel like my communication skills have been in all of my past positions, especially when I was a nanny, a caregiver, a LuLaRoe consultant, or I was also a personal grocery shopper. And I had to constantly communicate with my clients. And it was especially difficult communicating with even my own dad that I was caregiving for, because Parkinson's is such a neurodegenerative disease that it became difficult to communicate clearly. And he showed frustration at times, but I was his daughter, so it was easier for me to explain what was going on day to day and what we would be doing. And we got on the schedule of the day before. We would go over the next day and our schedule personally. And a time that I demonstrated flexibility was probably as a LuLaRoe consultant, because I would have to meet clients on a day-to-day basis, and they would sometimes cancel or reschedule or ask if they could meet sooner, and I would try to be as flexible as possible and work around their time and their schedule to provide a more pleasant experience for them. And personally, I've never dealt with a difficult situation with a coworker besides probably when I was a nanny was the most difficult situation, and it came to just the asking for a pay increase, because I'm not a confrontational person, but I brought up in the most pleasant way I could that I needed an increase and resolved the situation and was able to sit down and have a professional conversation with the mom and was able to get the pay increase to be able to provide the service as best I could. Thank you so much.